Hello everyone, today we'll be discussing cognitive theory. So first off, what is cognitive theory? Cognitive theory can be defined as the way an individual's thoughts impact his or her behavior and emotions. Cognitive theory is heavily influenced from behaviorism, also known as behavioral theory, which discusses how our actions are affected by what happens before behavior and the consequences that follow. An example would be the intention of repeating a behavior because it gives you a positive result versus the unlikeliness of repeating a behavior that produces a negative result or consequence. In our book, there was also an example of this, of an intern and therapist working together. An intern will more than likely use an approach that produced a positive outcome versus the unlikeliness of using an approach that created a negative result or consequence for the individual. As a response to behaviorism, cognitive theory states that thoughts, not just consequences, influence behavior. What is the focus of cognitive theory? The intended goal of cognitive theory is to help individuals in shifting their logical beliefs that are considered unhelpful in the process of change, otherwise known as cognitive restructuring, which is highly impactful in practice. Cognitive theory focuses on the role of cognition in the learning process, which can be represented in Alice, 1962, who studied cognitive theory and created the ABC framework to better understand the connection between cognition, behavior, and emotion. A represents an initial event, B represents a person's belief or perception of what has happened, and C represents the emotional or behavioral response. So cognitive theory focuses on what we value, why we value it, the attached meaning, and how we individually behave in the process to understand the role of cognition in the learning process. Cognitive theory follows this process closely in order to identify what areas need replacement thinking that will promote and support positive change. So an example of this can be negative self-talk, affecting our emotions and affecting our behavior. When cognitive theory is incorporated, this allows for an intervention to be created that will essentially help an individual focus on eliminating these thoughts or beliefs or behavior. Next, cognitive theory practice setting example. Regarding practice settings, cognitive theory often works with diverse client systems. According to Langer and Lietz, reinforcers can be positive or negative. They affect the behavior and can change the trajectory of the situation addressed. An example of a positive reinforcer is a social worker helping students find new solutions to improving their grades and encouraging the child to enhance or maintain them to reap the rewards in the future. The social worker can use a goal-setting system of helping the student set up short-term and long-term goal of what they want to achieve. A negative reinforcer gives the student alternatives towards better study tips, obtaining a tutor, and asking questions when they do not understand to become more aligned with their future goals. The social worker can use the process of cognitive restructuring while changing the behavior to change the outcomes of the student's success. So, practice setting 2. Cognitive theory can be applied to an array of mental health issues. One in particular is social anxiety disorder or social phobia. Social phobia is the fear of embarrassment or humiliation in social situations. Below is a step-by-step application of cognitive theory in a single case study. Clients started self-monitoring to observe thoughts, sensations, or behaviors. She was then encouraged to let go of safe behaviors, such as covering one's face, dropping shoulders, avoiding eye contact. Client utilized these behaviors when she feared rejection. Role play was implemented involving using both the safe behaviors and not using them. Client received feedback on how anxious she appeared to others. Client realized that her own perception of self was far more negative. Client reconstructed self-image and instead focused on exchange and others' social cues. Client came to the realization that nothing catastrophic actually happened, which resulted in her being more comfortable taking risks in social situations. So we have cognitive theory and social phobia again. Social phobia is the fear of embarrassment or humiliation in social situations. Below is the application of cognitive theory in a single case study. Client started self-monitoring to observe thoughts, sensations, or behaviors. She was then encouraged to let go of safe behaviors such as covering one's face, dropping shoulders, avoiding eye contact. Client utilized these behaviors when she feared rejection. Role play involving using both safe behaviors and not using them. Client received feedback on how anxious she appeared to others. Client realized that her own perception of herself was far more negative. Client reconstructed self-image and instead focused on exchange and other social cues. And lastly, client came to realize that nothing catastrophic happened, which resulted in her being more comfortable taking risks in social situations. Cognitive theory in practice, cognitive behavioral therapy, or CBT, uses tenets from behavior theory and cognitive theory to create an intervention strategy, which is now widely used in the social work field. CBT is based on two assertions: how our thoughts influence our emotions and our behavior, and how our behavior influence our emotions and thoughts. In practice, CBT assists clients accomplish their goals by changing the way they think, which helps change their choices, in turn making them behave differently and helping them feel different. Interventions within cognitive behavioral therapy: behavioral activation, reinforcement scheduling, desensitization, cognitive restructuring, and psychoeducation. CBT and diverse client systems. CBT focuses on the client's environmental and social context of their lives, providing an opportunity for the LGBTQIA+ population to have a better understanding of how their environments are impacting their mental health. The sexual and gender minorities often live in societies where they do not fit the dominant culture. With CBT, they are using a collaborative problem-solving approach. Iwa Masa explains that this helps the client develop and test hypotheses about particular problems and test new behaviors in everyday life. CBT also focuses of skill training, which can give the LGBTQIA+ population specific tools to cope with the stressors related to being part of a minority group in their communities. In addition, CBT can use cognitive restructuring to counter the internalized stigma that population encounters. So some strengths of cognitive theory are that it assesses and uncovers automatic thoughts and schema through interviewing skills. It also uses cognitive restructuring to identify unhelpful internalized belief systems and seeks to replace them with thinking patterns that support positive change. It is fully integrated in the process of practice from assessment to termination. It uses Socratic questioning to identify errors in thinking within the client's automatic thought process, which includes examining clients' internalized core beliefs that facilitates the emotions underlying the presenting problem. It is also an evidence-based approach, as can be seen in studies for depression, anger management, working with children and adolescents, older adults, and it can also be used with crisis intervention in trauma situations, impulse control issues, PTSD, social phobias, anxiety disorders, child and intimate partner abuse. Cognitive theory also places an importance on human relationships as well as worth and dignity of the client. It utilizes self-monitoring between sessions to assist clients in focusing on and identifying negative thought patterns, and empowers the client in the process of logically examining and changing negative thoughts and emotions. Clinicians provide encouragement and feedback to clients regarding their growth and change process throughout the therapeutic relationship. It utilizes rational and positive self-statements that can help clients reinforce new self-thoughts so that they are eventually substituted for the negative and self-defeating thought patterns. The concepts, principles, and interventions are relatively clear, and there is an ease of application of interventions, especially if adequate training is provided to the clinician. And lastly, interventions can be blended and combined, as combinations are thought to be more effective and impactful than single interventions. When it comes to limitations of cognitive theory, if clinicians are not competent in working with people of differing cultures, there is a risk that they will perceive the client's cultural value system as illogical and irrational. Clinicians also risk danger of imposing their authority as an expert on clients' values and beliefs. The therapeutic focus is usually on the individual level and their immediate systems, so micro and meso level systems, which lacks consideration on how the client's interaction with their environment and society as a whole, such as their macro system. And it also impacts their thoughts, emotions, and behaviors. The use of cognitive theory is less helpful at the macro level because it is difficult to charge large groups of people's thoughts and behaviors. So some more limitations are that Not all clients will benefit from cognitive theory because they may lack cognitive or social skills necessary to identify new thought processes and implement changes without more instruction and practice. It also attempts to reshape cognitive patterns and perceptions, which can differ vastly with the client's actual experiences, can be seen as a threat with diverse and involuntary clients such as court-mandated anger management clients or parents within a child welfare mandated parenting group. Diverse clients could perceive cognitive restructuring or a cognitive intervention as blaming or another form of social control and ideological domination. And our final limitation with cognitive theory is that it tends to attribute dysfunctional emotional processes to mistaken or unhelpful beliefs, but attention should be paid to other issues such as brain injury, neurological disorders, thyroid imbalance issues, unbalanced blood sugar levels, circulatory disorders often associated with aging, malnutrition, toxic substance ingestion, and other types of chemical imbalances. So that is it for our presentation today. I hope that you all enjoyed it and learned a lot about cognitive theory. Thank you.